Okay, so Diane and I are back again for another mock case investigation interview using the new Qualtrics form, um, the new Qualtrics survey. And I have another one of these fake MedSys IDs that I will need on this first page here to get things going. If I was going to fill out the form in Spanish, I would select that here, but I'm going to go ahead and leave it in English. Okay, I do need to type in my name. I am the interviewer. And then you'll see that the patient population is pre-populated. A reminder, this specimen collection date can be really important for people that are asymptomatic, and also just to sort of as a starting place to ask when people's symptoms developed. So I'm going to make a note of that, August 19th. And everything else should be all pre-populated. I'm going to click confirmed because I am not working on Ricardo's team. Okay, so this is the first page of the survey. Here's the script when I first make the call. And I'm going to get started as if I was calling a real case. Diane, are you ready?
I'm ready.
Okay, great. Ring, ring, ring.
Hello?
Hi, may I please speak to Leah Renish?
This is Lee Renish.
Hi, Lee. My name is Connor Fitzgerald. I'm calling on behalf of the Arizona Department of Health Services. How are you doing today?
I'm doing fine, thanks. How are you?
Doing well. I'd like to discuss some health information and ask you a couple questions. Would you verify your date of birth for me, Lee, just so I know I'm talking to the right person?
Yeah, my date of birth is 6/22/73.
Okay, thanks, Lee. Is that the correct pronunciation of your name?
Yes.
Okay, just wanted to make sure. Okay, so thanks for verifying that date of birth for me. I'm calling because we received your test results indicating that you tested positive for COVID-19
Yeah, I know
on the
that.
19th. Okay, and we're just calling to get a better idea of your symptoms and to see how long you've been sick, and also to do what's called contact tracing, which is to prevent the spread of the virus. All your answers will remain confidential, okay? Do you have time to talk right now?
Yeah.
Okay, I appreciate that, Lee. The address that I have on file for you is 3095 David Hill, Lower Hutt, Arizona, 85210. Is that right?
Yeah, that's right.
Okay. And do you currently live on tribal lands by any chance?
No.
Okay, just double checking. So what symptoms have you had with COVID-19, Lee?
I haven't had any symptoms.
Nothing at all, huh?
No, I just had to get tested for work.
Okay, well, that makes sense. You know what? I am going to list the other, not the other, I'm going to list some common COVID-19 symptoms to you. And if you could just tell me yes or no, I'd really appreciate it. Have you had a
Okay.
fever? Okay, thanks, Lee. Have you had a fever at all?
No.
Okay, sore throat,
No.
cough or shortness
No.
of breath or difficulty breathing?
No.
Okay, any chills or shivering?
No.
Okay, what about a headache?
No.
Any muscle aches or sore muscles?
No.
Okay. What about nausea, vomiting, or diarrhea?
No.
Okay. Runny nose or cold-like symptoms?
No.
Okay. Fatigue?
No.
Any loss of taste or smell?
No.
Okay. And finally, have you had what they're calling COVID toes, which is a reddish blue discoloration of hands or feet?
No.
Okay. Thanks for sharing that with me, Lee. Um, Prior to your COVID-19 diagnosis, um, I'm going to list a few common health conditions. And if you could just tell me if you had any of these prior to your COVID-19 diagnosis, okay?
Okay, I don't have
Mm,
any health problems.
Okay, but just to cross them off my list. Did you have diabetes or obesity by any chance?
No,
Okay. What about cardiac, heart disease, other than
no,
high blood pressure? Okay. Any
no,
high blood pressure?
no,
Okay. Any asthma or chronic lung disease such as COPD or emphysema?
no,
Okay. What about chronic kidney disease or chronic liver disease?
no,
Okay. Cancer, current or previous of any kind?
no,
Okay. What about other immune compromising conditions such as HIV, AIDS, Crohn's disease, lupus, organ transplant,
no,
autoimmune disease? Okay. Just double checking. Almost done here. Um, do you happen to take any medication known to lower your immune system, such as chemotherapy or systemic steroids?
no.
Okay. What about seasonal allergies? Do you get seasonal
Yeah,
allergies?
once in a while.
Okay. Thanks for sharing that with me, Lee. Are you a current or former smoker by any chance, including vaping?
No,
Okay. So I'm going to ask you some questions now about the 2 weeks before you develop symptoms. Actually, in your case, it would be the 2 weeks before you got tested, okay, since you never had symptoms. So the reason
okay,
why I'm asking about these 2 weeks before you got tested is because it can take anywhere from 2 to 14 days from the time you're exposed to the virus to the time you begin developing symptoms. So we're interested in this time period because it can sometimes give us a better idea of where you may have been exposed to the virus, okay?
okay.
So in the 2 weeks before you started feeling ill, sorry, keep saying ill because it's written here, but in the 2 weeks before you got tested, did you have contact with anyone who was positive for COVID-19 or who had COVID-19 like symptoms, like a fever, cough, or shortness of breath?
Uh, yeah, we had a patient come into our clinic, and we actually sent him to the hospital, and they said that he had COVID.
Okay, thanks for sharing that. That's helpful to know. In those 2 weeks before you started, in those 2 weeks before you got tested, did you happen to attend any gatherings with 10 or more people? So not at work, but things like parties or protest rallies or faith-based events?
No,
Okay. So next we're going to ask you a couple questions about your travel history and any possible sources of COVID-19 infection, okay? In the 2 weeks before you got tested, did you travel within the US or within Arizona?
no, I don't think we've gone anywhere for a while since all this COVID stuff started.
Okay. And just to clarify, so if you got tested on August 19th, we'd be talking about um, the 2 weeks before that. So from August 5th to August 19th.
No, we don't, like I say, we haven't been going anywhere except, like, to the grocery store and the gas station.
Okay, well, that makes sense. And I know you just told me you haven't been going anywhere, but just to double check, in those 2 weeks before you got tested, did you happen to travel outside the US by any chance?
No.
Okay, just double checking. Um, so now, Lee, we'd like to ask some basic questions about you, and these questions will be similar to what you see on forms when you go to the doctor's office. Okay,
Okay,
what gender do you identify as?
I'm female.
Okay. And when you fill out forms for ethnicity, do you mark non-Hispanic or Hispanic?
Non-Hispanic.
Okay. And what is your race? When you fill out forms, what do you mark for race?
Well, if there's a choice, I usually mark mixed.
Okay. And um, are you currently pregnant or were you pregnant during your illness by any
N-
chance?
No,
Or excuse me, I know I keep saying illness. If you were if you're currently pregnant or if you were pregnant when you got tested.
No.
Okay. So in the 14 days before you got tested, what was your occupational status, Lee? You mentioned that you were working at a clinic.
Yeah, I work at a dialysis clinic.
Okay. And were you working in that clinic the 2 weeks before you got tested?
I was working there up until the 15th, when that patient got sick. And then they
Okay.
said we couldn't come back to work until everybody got tested.
Okay. Got it. Thanks for that. So in order to detect outbreaks and protect the health of people who are at risk for developing severe outcomes for COVID-19, we have some questions about where you work, like I just asked. Um, but we won't share any of this information with your employer, okay, without your permission. Um, so I'm going to ask you about some fields that you may have worked in the 2 weeks before you had symptoms. Excuse me,
Okay.
the 2 weeks before you got tested. I'm sorry, I keep saying that, Lee. I know you didn't have any symptoms.
Well, I guess a positive test is a symptom.
Well, thanks for being patient with me. Um, okay, so you did mention that you worked in that dialysis clinic. Is that correct?
Yes.
Okay. I'm going to mention a few other places just quickly. Did you work or volunteer at a long-term care facility by any chance? So this would be something like a
No,
nursing home, skilled nursing facility, assisted living facility, or long-term acute care hospital or hospice.
no,
Okay. Um, any facilities serving a vulnerable population, including a rehabilitation center, halfway house, group home, homeless shelter, or senior adult daycare center?
no,
Okay, what about school facility K through 12 or other facilities serving children, including childcare or summer camp?
no,
Okay. Correctional facility, including jail, prison, juvenile corrections?
no,
Okay. What about a governmental office, including city, county, or state office?
no,
Okay. What about a law enforcement facility?
no.
Okay. So just the dialysis center. What's your job title at the dialysis center?
I'm a patient care tech.
Okay. Okay. And what's the name of the dialysis center where you work?
It's lower hut dialysis.
Okay. And do you have an address for Lower Hut Dialysis or cross streets?
Yeah, it's 1010 East Pine Street.
And that's in Lower Hut.
Lower Hut, Arizona.
Thanks for that. I always forget. Does Lower Hut have one T?
It has two T's.
Okay. Thanks for that. Never been to Lower Hut. Like to go someday.
It's a little town.
I love little towns. Do you happen to know the zip at Lower Hut Dialysis by any chance?
Yeah, it's 85210.
Okay, great. Thanks for that. Um, so did you happen to work at the Lower Hut Dialysis Center the 2 days before you got tested or since?
No, because they told us all we couldn't, everybody that was there on the 15th with that patient couldn't work until they had a negative test. And so when my test came out back positive, they told me I couldn't work.
Okay. When's the last time you physically went to work at Lower Hut Dialysis?
That was on the 15th.
On the 15th. Okay, just double checking. And it sounds like you did let your employer know about your test results since you got tested at work.
Yes.
Okay, that's what I figured. Just wanted to double check. Um, we'd like to send you a public health absence letter if you were interested to excuse you from work. Um, and a fact sheet about COVID-19. Is that something you'd be interested in?
Well, yeah, that's okay. I mean, they already know I can't come back to work. They said, until I think they said 10 to 14 days after my test.
Okay, yeah, and I'm going to go over um, some dates like that with you in just a minute, but I will go ahead and get you a letter just in case you need it. If you don't end up using it, no big deal, but you'll have it just in case. Okay.
Okay.
What's a good email address to send you the letter at?
It's L Renish, Renish,
Mm-hmm.
112 at
Mm-hmm.
gmail.com.
Okay. Thanks, Lee. I'll send you that letter as soon as I get off the phone with you. Okay.
Okay, that's fine.
Okay, almost done. Just a few more questions. What's your current living arrangement, Lee? Are you in a house or an apartment or?
I live in a
Um,
house.
okay. And who lives with you there in your house?
Oh, just my grown son.
Okay, got it.
But you know what? His girlfriend thinks she lives here.
Oh, does she stay there too?
Well, not all the time. She stays a couple nights a week here and there, and then she goes back to her place. And but she thinks she's part of this house.
Okay. Um, so just give me a second. I'm just getting to the next page of this form here. Not too much longer.
It's a long form you got.
I know, but we're almost done. I really appreciate your patience, Lee. It's a big help. And
Okay.
I wanted to let you know that the next part of the survey is about following up on any symptoms that you and your household members might be having. I know that you're not having symptoms, but we just want to double check to make sure that no one's developing any. Because we don't have a vaccine yet for COVID-19, recording current or newly developed symptoms is one of the only tools we have to prevent the spread of the virus in Arizona and ultimately save lives. So it is important. Okay. You and your household members will be asked to monitor themselves and report any symptoms that you may develop from COVID-19 to public health for 14 days. And this is done using the state of Arizona's automated system. So it's pretty easy. You'll receive a reminder each day by text or email to record symptoms. It takes less than a minute to complete, and it lasts only for the duration of your recommended quarantine period, okay? At the end of the
Okay.
quarantine, you'll be enrolled from the system and will not receive any additional correspondence at all. Okay. So
Okay.
to record symptoms in the automated system each day, one person can answer for everyone in your household. Okay. It's really easy to do. Would you like to be the one to answer for your household, or would you like to designate someone else to do it?
Well, I guess I'm going to have to do it because my son sure isn't going to want to do that.
Okay. That makes sense. Well, I appreciate you. Um, I appreciate you doing it, Lee. What's better for you, text or email?
I think text. It's easier.
Okay, yeah, usually is. Um, so is this a good number to send the text to?
Yeah, the number you're calling me on.
Okay, and just to confirm, is this 517-507-8827?
Yeah, that's right.
Okay. And is this a smartphone by any chance that connects to
Y-
the internet?
yeah, it's a smartphone.
Okay. Just wanted to check. That way you'll do it through a link. It's a little bit easier.
Okay.
Um, so now that we know who your household um, contacts are that are going to be monitored, I just like to get some information from them for the text. Um, so I'll just need to know their first and last name and their date of birth or age, okay? And that'll be for your son, okay?
I'm not sure that my son's going to want me giving out his information. He is an adult.
Okay, yeah, I understand that. It'll just be for the automated system, like I mentioned. So you're just going to get a text, and we're actually not even going to use your names. We'll just use your initials and your ages in the text, and that's all it will be for. It'll just be for monitoring your symptoms. We just want to make sure that everyone's doing okay. I know you're not having symptoms now, but we just want to check in with you and your son and make sure that neither of you start to develop symptoms. Okay.
Okay, but like nobody's gonna call him or bother him, right?
No, actually, I think that's why the texts are so great, because that way we don't have to have anybody get in touch with him. We do reach out to everyone who's been exposed to a positive case of COVID-19. Um, but since you live with your son, we would just have somebody, we would just send you a text to report his symptoms instead of having someone bother him with a phone call.
Oh, okay.
Okay, so does that sound good? I did want to double check though. You mentioned that your son's girlfriend stays there sometimes. Does she live with you two full time?
No, she actually has her own apartment, but she just likes to stay here because, of course, I have better food in my house than she does.
Okay. Well, we'll just include your son for the text then, okay? And just to get your son's information for those texts I was mentioning, what's your son's first name?
His name's Jack.
Okay. What's Jack's last name?
It's the same as mine, Renish.
Okay. And how old approximately is Jack?
Jack's 25.
Okay. And just give me 1 second. I just want to look at a couple dates, okay? Just 1 second. Okay. Almost done. Really appreciate your patience, Lee. Okay. And how's Jack doing? Is Jack experiencing any symptoms?
No, Jack's fine.
Okay. That's good. I'm really glad to hear that. Okay, so now I want to go over any other close contacts that you may have had recently. So the period of time that we're looking at is actually the 2 days before you got tested and then 10 days after. Okay, so if you got tested on the 19th, we just be looking at anyone who you may have been in close contact with between the 17th and today. Okay. Um, and what we define as a contact is anyone who you may have been within 6 feet of for more than 15 minutes, even if you were wearing a mask. All right. Um, does anybody fit that bill? Have you been in contact with anyone during that time period?
Well, I haven't really, like I say, except for Kylie, my son's girlfriend, who hangs out in my house. But I mean, I haven't personally been close to her.
Yeah, and I was going to ask you about her first. She was definitely at the top of my list here. Um, I did want to mention to you before I get your son's girlfriend's information that even though public health will be reaching out to your friend's girlfriend, we do recommend that you notify any close contacts that you had during that time period that I mentioned to you um, about their exposure to you, okay? Your name will not be shared with any of your contacts. For each individual, I'm going to ask you to say and spell their first and last name for me. I'll also need their age or date of birth. Next, I will need a way to get in touch with them, either by phone or email. Okay. Um,
Okay.
so your son's girlfriend, when's the last time that she came over?
She was over the night before I got tested. But when they told me the test was positive, I told him I didn't think it was a good idea. I thought he would be better off going to her apartment.
Okay, got it. Since she was over the day before you got tested, I would like to have somebody follow up with her anonymously. That's how it's always done. Um, is there anybody else that comes to mind that you may have been in contact with during that time period that I mentioned to you? 2
No,
days
we've
before you got
we've been
tested
really
to today?
careful. We haven't really been going anywhere or doing anything, and we wear a mask wherever we go. So
Okay, no neighbors or family members stop by unexpectedly?
no, no,
Okay,
we're kind of loners.
okay, got it. Just wanted to double check. Okay, so I would like to have somebody reach out to your son's girlfriend just to make sure she's doing all right and to give her some quarantine recommendations. What's her name?
Her name's Kylie.
Kylie.
Yeah,
Okay, and what's Kylie's last name?
Woods.
Woods.
Yeah,
Okay, Woods.
yes.
Okay. Um, and do you happen to do you have an age or a date of birth for Kylie?
Actually, yeah, because I know her birthday is on Christmas.
Oh,
So
really?
her birthday is 12/25, and the same year as my son, 95.
Okay. Wow. Christmas baby. You have a phone number for Kylie that we could get in touch with her at?
Yeah, I have to look that up. Hang on a
Yeah,
minute.
take your time. I'm in no hurry.
Okay, it's 517
Mm-hmm.
507
Mm-hmm.
1167.
Okay, thanks for that. Just to confirm I have the right number. 517-507-1167. Is that right?
That's right.
Okay. And where does she live in Lower Hutt as
Yeah, she
well?
lives. Yeah, she lives in Lower Hutt.
I figured. Just wanted to double check. And you said she was over there on the 18th of August, if I'm not mistaken. Does that sound right?
Yeah, it was the day before I got my test.
Okay. Um, what's Kylie's preferred language, English or Spanish? Or
Uh,
a different language if that
she
is the case?
actually she actually speaks both, but I think she prefers English.
Okay, that's helpful for us to know. Okay, that's just about it for me, but I do want to give you a couple of very important dates. Lee, do you have a pen or a pencil to jot these dates down for? To jot
I
these
can
dates down with?
I can get one.
Okay, I'd appreciate it.
Okay, I got one.
Okay, so the first date is August 29th. Okay, Lee, August 29th is the end of your isolation period. So what I mean by isolation period is between now and the end of August 29th, you should isolate from your son as much as possible inside of your house. So try not to be around your son. If you can stay in a separate bedroom and ideally use a separate bathroom, although I know that's not always possible, that is ideal. You should also stay at home during that period, not go to the store, not see other people, and not go to work. Okay. I know that that's not always easy. Do you have a plan to isolate from your son through the end of August 29th? And if
Yeah,
so,
well,
what's that plan look like?
he's young, so I mean, he's always out and about. But since I got that positive test result, you know, he kind of eats in his room. He's got his TV and all his computer stuff. So, and we both wear masks all the time. And he has his own room and his own bathroom and everything. So that should be fine.
Okay, great. I'm glad to hear that. Um, the other date that I have for you is September 12th. Okay. That's the quarantine date for your son. So between now and September 12th, your son should stay at home, um, not see other people, and not leave the house. Okay. And I know that's a long time, but the reason for that is because you could potentially give him the virus without wanting to through the end of August 29th. It can take up to 2 weeks for people to develop COVID-19 symptoms. So, in order to prevent him from unintentionally spreading the virus, we will recommend that he stay at home until September 12th. Okay.
Oh, his girlfriend's not going to be happy.
Yeah, it's not easy, but that will really help to prevent the spread of the virus. Okay.
Okay, I'll
Now,
tell. I'll tell him.
okay. Now, in your case, Lee, starting on August 30th, as long as you don't have a fever and as long as you're still not having symptoms or your symptoms haven't gotten worse, let's put it that way, you'll be free to come out of isolation and you can be with your son for the remainder of his quarantine period. Okay. You don't have to continue to isolate from him through the end of his quarantine period. You can also, start going to the store again to pick up groceries starting on August 30th, as long as you don't have a fever. Okay.
Okay, so do I have to have a note to go back to work?
The letter that I'm going to send you um, may serve as a note, like you're talking about. So I'm going to put August 29th in the letter for the date when your isolation period ends, and that's a work absence letter that does help some people to be excused from work.
Okay.
Okay. Um, Now I know it's not going to be easy to stay at home, especially while you're both at home, while you're in isolation and your son's in quarantine. Um, what do you have a plan to get groceries, to get food delivered to you during that period? And if so, what's that plan look like?
Well, I guess I could ask my sister to go get my groceries. She only lives about 3 miles away.
Okay, well that would be great. Um, Thanks for sharing that with me. Okay, the last date that I have for you is July. Um, excuse me. Give me 1 second. Forget that I said July. So the last date that I have for you is for your son's girlfriend. Okay, since she came over on August 19th. Just give me one
She came
second.
over the day before I got tested.
On August 18th. Thank you for reminding me of that. It's been a long day. Since she was over there on August 18th, um, she needs to stay in quarantine until September 1st. Okay. So if possible, she should not come over to your house until September 1st. She should stay where she lives and not go out and not see other people until
That
September 1st to prevent the
that's
spread of
the
the
best
virus.
news you've given me all day.
Well, I'm glad to give you some good news. Do you have any questions about those dates?
No, that makes sense.
Okay, and sometimes I don't do that great of a job of explaining myself, and I said something about July. Would you mind telling me what those dates are that I gave me and what the recommendations that I gave you in your own
Yeah.
words?
Yeah, well, you said that I shouldn't be going anywhere until August 30th, and I'll check with my boss because I don't know how long they want us to be out for. And then you said my son shouldn't go anywhere until after September 12th, which I know isn't going to make him happy, but we'll figure out a way to deal with it. And then you said that I need to tell Kylie she shouldn't go anywhere and she should stay home until September 1st, and that's okay.
Thank you so much for repeating that to me, Lee. I really appreciate it. Um, so just to summarize and wrap things up, we do ask that anyone who's in close contact with you self quarantine for 14 days after their last exposure to you. Okay, For anyone you share a home with, they will begin their 14-day quarantine period at the end of your self-isolation period, like I just said. This means that they should not attend work or school if possible. And those outside your household can begin their 14-day self-quarantine from the last time they were around you. Please remember that anyone experiencing symptoms should stay at home and away from other household members as long as possible. Household members should stay home and monitor for symptoms. We suggest you notify anyone else you've had contact with of your positive test result, okay? Please remember that
Okay.
everyone should be washing their hands frequently. I know it sounds really simple, but this really helps. You can wash your hands with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer, and wear cloth face coverings, especially when you're in public after you come out of isolation, okay? We
Okay.
also have a team of dedicated, we have a dedicated team for providing you additional services such as housing assistance, financial assistance, mental health resources, and shelter services. After our call, you can dial 211 or visit 211arizona.org for additional resources. Okay, Lee?
Okay.
Okay. Thank you so much for sharing your information with me today, Lee. I really appreciate it. It's a big help. Do you have any other questions for me or anything else you'd like to add?
Just one question. My son, he works at home on his computer. Can he still be doing that even though he has to stay in the house? He can do that, right?
Absolutely. If he feels well enough to work on his computer, that's not going to hurt anyone. That's not going to, there's no risk of spreading the virus that way.
Okay, yeah, because, we can sure use the income.
Yeah. Well, I'm glad that he can keep working. Okay. Anything else, Lee?
No, that's good. Thanks.
Okay. Have a great rest of your day. Okay. Take
Okay,
care.
thanks. You too.
All right. Bye.
Bye.
Okay. So that will do it. There are case notes here if I wanted to add anything else about the case. And I am responsible for sending that letter out after the call. So I need to make sure that I have that email if it doesn't auto-populate here, which it should in the near future. Anything else you want to add, Diane?
No, I don't think so. Great job, Connor.
Okay, great job to you. You're an excellent case. All right, bye everyone.